about, recently we have a few wild animals like tigers. They develop cancer, bone, tumor. So since you're an orthopedic, so does this MRI also you're able to detect in the imaging?
Yes, so there are different types of cancer. So when we are particularly MRI, so first answer to your first question, of course, this machine can be used for tigers, lions, goats, dogs, cats, or even smaller versions, birds and guinea pigs, rabbits. So let's say there is a tumor in the brain or in the spinal cord of a tiger or any animal. It's only possible to detect that with an MRI. Precise location. Is it precise location and the nearby anatomical landmarks, which allows you later on to either treat it medically, go in for a biopsy, or to surgically remove it. So you are focusing on diagnostics by the use of MRI, which helps you later on to chart out a treatment plan.
Thank you. Recently, one of my friends come in from Iran. So he just told me yesterday night that he has a parrot, Tota. And he said that Tota is not eating. So उसका lung effect हो गया. I was shocked what he's talking, because, and he said his wife is going to take him to Iran, some hospital, and the lungs. So you were into cardiology. So lungs, and I think it's part of essential.
Yeah, so over here at our practice, we have different specialists. So exotic medicine and surgery, it is handled by a separate group of specialists. So we have three of our doctors on panel. But yes, coming to your question of lung diseases in birds, they are there. Lots of them are there. They are prone to a lot of fungal infections. Aspergillosis is one of them, just to name a few. Um, so in birds, I mean, these set of problems definitely are existent, and if we talk about other species, dogs, cats, and all different varieties of animals which are there. So there are different imaging diagnostic tools which are there. You have X-rays, you have CT scans. So each imaging modality, it is very important to understand where to use it in which condition. Like for a lung problem, probably a CT scan may be a good option. If you want to diagnose a heart problem, and if it's a functional heart problem, something to do, for example, like the contractility of the heart, then probably your best choice is going to be an echocardiography, which is an ultrasound of the heart. If there is a tumor in the brain, or if there is a spinal cord compression because of, let's say, a disc prolapse, then your best answer to diagnose that is going to be an MRI. So a knowledge and understanding of which imaging modality to use when, that is very important. And as far as species are concerned, every species is different, and there are specialists for various species. Cat is going to have an entirely different set of problems than a dog. Um, Birds and other exotic animals, they are going to carry a different set of problems. Over here at MaxPetZ, our focus is entirely, apart from the community practice includes, vaccinations, dewormings, basic, giving basic knowledge about the nutrition, about spays and neuters. So apart from that, which is also a very, very important aspect, when it comes to animal welfare and treatments. But apart from that, our focus is also on tertiary healthcare, which includes, super specialities. And we encourage here to all our veterinary doctors, our aim is to see, who is better in which specialty, and the interest of that particular doctor is in which specialty. And then we try to offer trainings in that particular specialties to that particular person, so that a group of specialists is developed. So that is how we focus here on healthcare. One more thing which I would like to add is that I'm really happy with the evolution of veterinary healthcare. There was a time when X-rays and ultrasounds were a distant reality. 30, 40 years back. And then slowly, these things are a routine now. So X-ray and ultrasound is now widely available, right? Similarly, 10 years back, a CT scan for any small animal, be it a dog or cat or any other species, used to be very difficult to do that. We used to find human imaging centers. But in 2019, we launched our first, the first CT scan machine for small animals in India. And after launching that in about 1 to 2 years, we realized that how our practice has changed because of that. How the diagnosis has changed, and because of proper diagnosis, how we treat that has changed. And now with the launch of this MRI, the cases which require MRI, and then of course accurate diagnosis, and then cutting down to all the treatment options, medical as well as surgical. So in that regard, I think it is going to be a game changer. And Dr. Kunal has been doing a lot of orthopedic and neuro work, a lot of surgeries he's been doing. So I'm very hopeful that it is going to be an added feather to his work, to the work which he is doing. And as far as I'm concerned, since my forte is cardiology, so I'll try to see how we can further enhance clinical cardiology as well as interventional and hybrid surgical cardiology in India in small animals with this. So the future looks bright to me, and for me, one thing which is very important is that we grow as a community. So it is not just the growth for us as a MaxPetZ hospital, but this is also for veterinary doctors from all over India.
All right.
So together we grow.
Thank you. Some other friends would have questions.
Now for the parent, we have got a specialist doctor who has specialized in exotic animals. So, the parent, if in Delhi or can be brought to the hospital, probably, diagnosis as well as treatment available in the present times can be carried out.
Right. Thank you, sir.
Sir, what partnership or collaboration helped make this installation possible?
Sorry, I couldn't hear you. Could you say it again?
What partnership or collaboration helped make this installation possible?
Can I answer this?
Yeah.
I think
Can I answer this? So basically, as I mentioned, that eSaote is one of the world's #1 company in veterinary imaging healthcare system. And as you were listening to Dr. Bhanu, who is a leading pacemaker cardiologist who puts a pacemaker to the dogs and the cats. So, and similarly, the leading neurosurgeon and orthopedic surgeon, Dr. Kunal, and the senior veterinarian, Dr. M. Sharma. Our collaboration is very clear. This is, as I mentioned, Magnifico Vet is Asia's first MRI is being installed at MaxPetZ. And our collaboration is based on the training programs which we are going to conduct for the veterinary doctors under their umbrella, and we have collaborated with the series of education program. And as when Dr. Bhanu was mentioning that, I'm just mentioning again about his vision. It is not only a top-end MRI they have acquired from eSaote, also a top-end echocardiography system Dr. Bhanu has ensured for his sort of patients. So our collaboration is totally purely based on education and training program for the other doctors who want to learn under them, who want to diagnose properly, because as we say that animal doesn't have the voice to convey their pain and all. These sort of equipments will become their voice. And as Dr. Bhanu also mentioned about the evolution, this evolution has to be brought into various small towns, and MaxPetZ and eSaote has collaborated to take it through all B-tier, C-tier cities also who are not having such facilities. As sir has mentioned just very shortly that the first question which he asked about the horses,
Yes.
this thing. So there are a lot of hospitals, they inquire about having our sort of an MRI, and then when it comes to the funding to this thing, I just mentioned about a small instance which I met some of the leading personnel in the public sector, and one of the reply which I got was like, I was shocking. I mean, they said that after the knee of a horse is gone, they are useless for us. So why this is a proud moment for eSaote? We are not collaborating with the legacy. We are collaborating with the intent of a family. Mr. M. Sharma's father, in 1952, they started this practice. And Dr. M. Sharma might have, think of educating their children to some other field. But the love, the kindness for the animal, just very recently we lost one of the billionaire businessmen, Mr. Ratan Tata. He has allocated a budget of 5,000 crore or so. I am not confirmed about the figure, but enormous amount of this thing, because he misses that companionship, and companionship was fulfilled by his dog. So, and this is what we look into this family, that their intent, their care, their kindness, and to the level which they are taking this particular field is unimaginable. So we are really thankful, we are really blessed, and feel proud to get associated with MaxPetZ. Thank you.
डॉक्टर ह्यूमंस में तो कार्डियक डिजीज या कैंसर के होने के लाइफस्टाइल डिजीज माना जाता है, क्योंकि उनके लाइफस्टाइल खराब हो जाते हैं, इस वजह से ऐसा होता है. बट पेट्स में ये क्या रीज़न होता है कि उनको कार्डियक डिजीज हो जाए या फिर कैंसर डिजीज हो?
बहुत इंटरेस्टिंग क्वेश्चन है आपका. सो हम जो सोचते हैं कि ह्यूमंस के अंदर जो बीमारियां हैं, आपको वो सब सिमिलर बीमारियां डॉग्स, कैट्स, इक्वाइन, घोड़ों में, गाय, भैंस, सब में देखने को मिलती है. जैसे हमारे पास ब्रेन है, उनके पास भी ब्रेन है. हमारे पास हार्ट है, उनके पास भी हार्ट है. एक बड़ी कमाल की बात है कि लाइफस्टाइल चेंजेस जो हम में आ रहे हैं, चाहे वो अच्छे हैं चाहे वो गंदे हैं, चाहे वो मोबाइल फोन रेडिएशन है, चाहे वो जेनेटिकली मॉडिफाइड सीड्स हैं, इंसेक्टिसाइड यूज है, पेस्टिसाइड यूज है, या कोई भी और प्लास्टिक यूज है, प्लास्टिक वाटर बॉटल्स है, जो भी चीज़ें हैं जो कहते हैं कि कैंसर या कार्सिनोजेंस हैं, जिसकी वजह से कैंसर ज़्यादा हो रहा है, तो वही सारा एक्सपोजर एनिमल्स को भी तो मिल रहा है. एक तो कारण ये हो सकता है कि कार्सिनोजेंस बढ़ रहे हैं. दूसरा एक ये भी है कि डायग्नोस्टिक एबिलिटी बढ़ रही है. तो पहले जो चीज़ डायग्नोज नहीं होती थी, चाहे वो इंसान था या जानवर था, अब वो चीज़ डायग्नोज हो पा रही है. तभी हम उसकी ट्रीटमेंट के बारे में सोच पा रहे हैं, ट्रीटमेंट कर पा रहे हैं. सो ये दो तरीके की का क्वेश्चन था आपका. आई होप ये आंसर
डॉक्टर साहब, इस MRI की मशीन में सिर्फ डॉग का ही हो सकता है या किसी पेट का हो सकता है?
नहीं, जैसे बताया कि ये एक वेटनरी स्पेसिफिक मशीन है जिसमें खाली डॉग, कैट से ये खाली it's not just restricted to dogs and cats. You can use it for any animal, starting from a small little bird to a mouse to guinea pigs, hamsters, rabbits, cats, dogs, even tigers and lions. और उनके बीच में जितने साइज के जानवर आते हैं उन सबका हो सकता है.
तो कई स्टडी जो होती है MRI के आफ्टर, तो क्या सबकी सेम होती है क्या अलग अलग होती है?
नहीं, सबकी एनाटॉमी अलग है, फिजियोलॉजी अलग है, स्पीशी वेरिएशन है ये। सो हर स्पीशीज की अलग एनाटॉमी है, अलग फिजियोलॉजी है। तो उसके बेसिस पे इनकी जो इंटरप्रिटेशन है, क्योंकि एमआरआई ने तो हमको इमेजेस देनी है, उस इमेज को फिर इंटरप्रेट करना है, जिससे रिपोर्ट बनती है, जिससे डायग्नोज करा जाता है। तो एक इन डेप्थ नॉलेज ऑफ एनाटॉमी, फिजियोलॉजी ऑफ वेरियस स्पीशीज इज वेरी इंपॉर्टेंट। उसके बिना हम इमेजेस को इंटरप्रेट नहीं कर सकते। तो इसके लिए eSaote के साथ मिलके हमने ट्रेनिंग्स ऑर्गेनाइज करी हैं, और ये हमारी कोलैबोरेशन है, जिसमें हम पहले हमारी टीम ट्रेन हुई है इसमें, और हम यही ट्रेनिंग्स और वेटनेरियंस को इंडिया के अंदर eSaote के साथ मिलके प्रोवाइड करेंगे।
सर जो है वुमेन्स के एमआरआई के जो मशीन होते हैं उनमें और इसमें डिफरेंट क्या होता है, क्योंकि ये तो एनिमल्स हैं और वो वुमेन्स का।
इसमें अगर आपने देखा हो कि डिफरेंट तरीके की कॉइल लगती है, अगर आपने किसी को कमर का ह्यूमन में देखा होगा, तो वेटनरी में अलग तरीके की कॉइल्स होती हैं। एनिमल का इंटरफेस जो होता है, अंदर जो मेजरमेंट्स होते हैं वो कैनाइन के अलग होते हैं, डॉग्स के अलग होते हैं, कैट्स के अलग होते हैं, टाइगर के अलग होते हैं। तो अलग अलग मेजरमेंट सिस्टम्स, अलग अलग कैलकुलेशंस होती हैं इस एमआरआई में। तो दिस इज टोटली डिफरेंट sort of an MRI which is dedicated for veterinary animals. Having said this, that this is Asia's number one, the first installation of this model. इसका मतलब ये नहीं है कि हमारी एशिया में दूसरी MRI नहीं लगी हुई है, because when I met them first, they asked me, I have seen your machine in Thailand, I have seen your machine in Hong Kong, I have seen your machine in Australia, why not in India? And so they wanted some machine in India which is first time in the world, and we have just recently launched this machine in the world 2 years ago, and the first one fortunately we are installing in India. It's a proud moment for us. So this is a 100% dedicated MRI for veterinary animals.
On the technical front, when you talk about MRIs,
So I was when Madam asked some, Sir asked some question.
Yes, sir.
I was opening up this thing when I entered into this field. I was never aware that the dolphin have 3 stomach, which I learned from them. I was sharing a picture with them. The octopus, they have 5 brains or something like that, 8 brains. So और जो ह्यूमंस में जैसे हम स्कैनिंग करते हैं, जैसे डॉक्टर भानु इको करते हैं, हम लोगों का तो फ्लैट सरफेस होता है, एनिमल सिलेंड्रिकल होते हैं। सो आई मीन दीज आर द थिंग्स विच वी बिन हमारी ह्यूमन में एमआरआईज बहुत रिसर्च यूनिवर्सिटीज़ में लॉट ऑफ लीडिंग सेंटर्स पे लगी हुई है, बट दिस इज ऑल्सो अ प्राउड मोमेंट फॉर अस। वी बिन गेट इट एसोसिएटेड विद MaxPetZ. So this is all about Magnifico launch and this thing. If you have any further question, we have registration kit with some material in the pen drive which is lying at the center. We have to go out in the right. There is a setup, so you can click the pictures of the MRI live machine over there. And before that, we have also served the snacks for you. And we are very sorry about this rainy season. It's not in our hand also, but thanks to you that you have reached to the place. Thank you.
So my
And your
question on the
is-
technical front, suppose you have a Tesla machine, no, in the human MRIs. So is this also, does it have a Tesla? And how many Tesla is this machine? And firstly, we were not able to know where your company's origin is from.
Yes, so we are an Italian-based company, sir.
Right.
And we are considered as one of the top 5 imaging company in the world. If you travel to Europe, eSaote is a very well-known name. And coming to the Tesla thing, when we proposed this project to MaxPetZ, they were not only concerned about the health and the diagnosis, they want something which is environment friendly also. So most of the high Tesla MRIs, they run on a helium gas. In this machine, no helium gas is required. Helium gas is on depletion, and there is a waiting of 6 months to 8 months for getting a helium fill. Another thing which they were concerned about their animals and the patient. You must have seen the other MRI create lot of noise which is scary, and generally you might get earphones to wear when the MRI is being done. It is noise free, helium gas not required, and it runs on 3 kV of electricity. Most of the MRIs they run on 50 kV of electricity, and this machine runs on just 3 kV of electricity, which is a torque of 1.5 ton AC. So they were quite concerned that how much is going to be the carbon footprint of this machine when they were considering this, which talk about their philanthropist thought process that not only animal healthcare, but it has to be environment friendly. So this is 0.4 Tesla MRI, because we are in an AI era. The kind of quality of image this machine produces is even better than any 1.5T or 3T MRI. So in an artificial intelligence era, we have a dedicated feature in this machine. We call it as a hyper clarity and hyper speed. eSaote is the feature name, which has been researched in an Amsterdam-based university and by a US-based company, so which has been incorporated in this particular MRI.
A normal human MRI is diagnosed by the radiologist. So here, do we have a separate radiologist, or just the surgeon or Dr. Bhanu would do it on his own?
Yes, because it's more of a procedural, so they can also prescribe and they can diagnose. But I will pass on this question to Dr. Kunal and Dr. Bhanu.
So here also in veterinary science now there are various specialities, and one can take up various specialities. There are specific master's program in diagnostic imaging which is offered in Europe and in some universities in US. So yes, veterinary doctors from here, they can go to those places. Over here, in our team, we have some certain set of doctors who have done courses for diagnostic imaging and who have done certifications in this. So yes, we have specific people, who are going to be doing and performing the MRIs.
सर MRI की cost क्या थी?
MRI की ये जो particular machine है, this is just recently launched. It's one of the latest machines in the world. Globally ये 1 million euros की launch हुई है.
And how much does the MRI per patient cost, say for a dog full scan?
So as I mentioned, they are more of a procedural hospital.
Right.
Like before surgery and after surgery,
So it's all
it will come
included.
into the package. Sometimes they charge and some